Is back with the chapter care in the operating room. Once we have discussed the steps or the care which you should take immediately before the surgery. The second step is operation. Operation. The second thing is the operation. Remember, to start the operation, first of all, what we do, we transfer the patient. Transfer the patient from bed to the operating table. Operating table. Remember, the process of this transferring from the bed to the operating table should be slow, should be smooth, and should be under the supervision of surgeon and anesthetist. And there should be enough person in the operation theatre to perform this transfer. And remember, prevent the patient from any injury during this process of transferring from bed to the operating table. Cover the patient eyes, thyroid, gonads, etc. to prevent it from injury, and and also provide the patient with pads to prevent the pressure sores, etc. So this was all about that how you will transfer the patient. Once you have transferred the patient to the operating table, then provide the patient aseptic conditions free of bacteria, free of any pathogen, because these conditions reduces the risk of wound infection. Once you have provided this, it's the time to scrub. What? Scrubbing. Scrubbing means that the washing of hands and arms to prevent the microbial transfer from the hand of the surgeon or the workers of the operation theatre to the wound. This prevents the wound infection. There are three commonly used solutions for scrubbing. The first one is chlorhexidine gluconate. The second one is chlorhexidine gluconate. The second one is alcohol, and the third one is iodine. These are the three commonly used solutions for scrubbing the hands and arms. Remember, if the surgeon or the operation theatre personnel having infection, they should not scrub. Anyone with having any active infection, they should not scrub. This is the rule. And once you are scrubbed, do not touch anything which is unsterile. This leads to contamination. Okay, once you are scrubbed, then what you do? Gowning. Wear the gown, then gloving. Put on the gloves. Gloves provide two important functions. One prevents the wound contamination by the surgeon hands, and the second, it prevents the operation theatre workers coming in contact with the patient's blood and body fluids. This is the universal precaution that if the patient is HIV positive, hepatitis B positive, hepatitis C positive, the surgeon and the operation theatre worker should put on double gloves. Okay. Now, when the patient is on the operation table, prevent two things. One, hypothermia, we have discussed it already. The second thing, prevent the patient from accidental injuries. These injuries can be offered by the tired staff of the operation theatre, by the instruments, and other reasons can also be there. So this was our discussion on operation. How you'll immediately before operation, what you will do. Okay. Now here's the time to give incision to the patient. But remember, here, for example, this is the patient, and in the abdomen you are going to perform a surgery, for example, appendectomy. Here you will give the incision. For example, just imagine, before you give the incision, you prepare the skin. This skin preparation is just for the purpose that There should be no bacteria or other pathogens on the skin of the patient. It should be pathogen free, so that when you give incision, there should be no bacteria and there will no wound contamination. So this is the purpose of skin preparation. Remember, this skin preparation is simply, or generally, people what they call it, skin prepping. Skin prepping and preparation is the same thing. How you prepare the patient's skin, or how you prep the patient's skin, there are two steps. There are two phases. One is called pre-prep phase, the other is called prep phase. In the pre-prep phase, what you do, you remove you remove any dust or any debris or any plaster of Paris, etc., from the patient's skin by soap disinfection or by taking shower. So the patient should take shower on this day of surgery, so that it removes the dust, etc. And in the prep phase, what you do, you apply the prep solution. Commonly used solutions are alcohol solution. So is it clear? Remember, for example, this is this area where you will give incision. So start your work of prepping skin from the incision side outward, not come like this toward the wound side. Go outward from the wound side, from the site of incision. This is very important. And remember, give two coats of prep solution, at least two solutions, and then dry the excessive solution with the dry swab, or remove the dry swab with the dry swab. And the areas which are normally heavily contaminated, like axilla, perineum, or groin region, they should be cleaned or decontaminated at last. This was all about skin preparation. After you have prepared the skin of the patient, for example, this is the point where you will perform surgery. Then what you do, the second step is draping. What you do? Draping. In the next section, we will discuss what is draping. Thank you very much.